Ladies and gentlemen, I would like to thank My King Lives for this article. And this is the city of Philadelphia. They have declared a public health emergency due to a hepatitis A outbreak, which is from the drug usage. Now, one thing about the city of Philadelphia, your biggest drug users are actually Hispanics. And then followed by the Hispanics are white people. Those are really your biggest junkies as far as the opioid addicts are concerned. Now, I'm not shocked that there's an outbreak because whenever you have a lot of people doing drugs, you're going to have people sharing needles. You're going to have people also having sex for drugs. And that's another way that all of these diseases are spreading. And not only that, you got to understand people are living out on the streets. They're not clean. These junkies are literally living on the streets. So they are not washing and practicing good hygiene on a regular basis. Health officials in Philadelphia have declared a public health emergency due to an ongoing outbreak of hepatitis A. Healthcare providers and other agencies have been directed to help vaccinate those most at risk for the infection in order to stop the outbreak. According to the Philadelphia Health Department, the city usually sees between 2 to 6 cases of hepatitis A per year. Since January, the health department has been notified of 154 cases. Yeah, that's going to continue to go up, y'all. It just is. It since July 2018, the health department has coordinated vaccination of 1,775 people considered at risk and reports that more than 12,439 total hepatitis A vaccinations have been given in the city, but it hasn't been able to end the outbreak, officials say. Yeah, because it's too many people on drugs. It's too many. It's not controllable. Ladies and gentlemen, this is why this thing has been running strong for 20 years. It's too many people out here on drugs. They are never going to eliminate all of anything. If you don't want anyone to contract hepatitis A, and we have the ability to stop this outbreak now that we have a safe and effective vaccine, the most important action we can take for everyone at high risk to be vaccinated. Dr. Thomas Farley, health commissioner in Philadelphia. Hepatitis type A is an infection of the liver caused by a virus that is spread by the fecal oral route. Yeah, because these people are not clean. They are homeless living out on the streets, many of these junkies, you know? And yeah, they're going to spread that. They're going to spread it all kinds of ways, and either through personal contact or consumption of contaminated food or water. Okay, so the people that are the most highest at risk are people who use drugs, people experiencing homelessness, men who have sex with men, people who are currently or were recently incarcerated. Many, many times I had to clean up in front of our own building because overnight people have used it when they didn't have facilities, he said. All right, so Kensington is the main area they're talking about as far as hepatitis A, and Kensington has really been a hot spot in Philadelphia for drugs. The last time I was over there, I looked down on the ground. The needles were everywhere. They were everywhere. And you really have to be careful when you go in areas where there's a high amount of drug addicts, just in general. You're walking down the street, they're going to the bathroom. Yeah, they go to the bathroom and do everything out in the open. Everywhere you go, there's feces all over, and they're not talking about feces from dogs, they're talking about feces from humans all over when you go down to Kensington. Those who have been diagnosed should take steps to prevent transmission, including hand washing, avoid food preparations for others, condom use, and drug use harm reduction practices. The city will also be expanding its own outreach to vaccinate homeless persons and others at great risk. Ladies and gentlemen, this is just disgusting. But this is what's going on in the country. You know, it doesn't matter if they make this a public health issue. It doesn't matter if they keep getting money from Congress and the Senate and Trump and his opioid commission. You see, it's not making any difference out here. When you let a drug addiction spiral this far out of control, ladies and gentlemen, do not be surprised if over the next decade, this damn addiction will still be going strong. They have no way to control it. Everything they're doing now is too little too late. And they're even conceding in the article they cannot completely get rid of this thing. They have vaccinated over 17,000 people, and this thing is still spreading in the city. So, hey, you wanted to declare this a public health crisis. You don't want to jail people. You don't want people to go to criminal court. They go to drug court. You want to coddle these junkies. You want all of us to go get Narcan and help them on the street. This is what you want. But you're still, with all of that in place, you're still not getting to the root cause of the problem. And at this point in time, you're just enabling these people. That's all you're doing. You're not helping them. You're not even getting the majority of them into rehab. You're not doing that either. You're enablers, setting up these safe injection sites. You're enablers. It's a legalized crack house. That's all it is. But anybody else that gather together and go do drugs in a location, you want to round them up and arrest them. This backward ass society will never change, y'all. And they are not going to overcome this drug addiction, because just by the way they're doing this, they are not going to overcome this thing. This has gone on longer than the crack epidemic and claimed more lives. They're trying to scale down the numbers because they don't want you to see how bad it really is. But it's bad. It has exceeded any drug addiction that has happened in the US, y'all. It's exceeded everything. But no surprise that this has happened. I remember 2 years ago doing these stories on San Diego and their outbreak of hepatitis A. And their solution, they were putting these hand washing machines out on the streets for the homeless to try to get rid of it. But there's no getting rid of this stuff, y'all. As long as these junkies are out on the street, they're going to be sharing needles. They're going to be having sex. They're not going to be clean. And these outbreaks will continue on. How do you stop it? You really, seriously, you can't. You can't follow these junkies around. It's unrealistic. But hey, this is the way they chose to do it, there's consequences, aren't there? And there are consequences they're not going to be able to do anything about. It doesn't matter what soapbox Trump gets on claiming that he's decreased the amount of people on opioids. He's lying. He's lying. And this outbreak is one of the proof that he is lying, okay, along with the opioid deaths that are still going on in the country. Please tell me what you think, ladies and gentlemen. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.